So when you're talking about 42 different languages and 40 different identity groups, the things that are meaningful to those communities can be really varied. So we really wanted to take the time to make sure that we were looking at all the things that were important to those communities and finding a way to incorporate those.
The thought of losing wisdom keepers and storytellers who hold the knowledge of their communities was terrifying. And to be separated and to not have community together was even more terrifying. So when the vaccines came out, it was exciting, but it was also scary because of historical injustices that have happened in the past in the healthcare system. So Intertribal Council of Michigan did a lot of work to make sure that tribal communities knew what the vaccines entailed and where tribal community members could get the vaccines.
I think it's important to think about shifting the paradigm from a top-down approach to running a project, to building a project, to running the project, to more of a collaboration. And I think what's important to know for people implementing these things is that when you're talking about doing a collaborative approach to any kind of project, it's not just a one-time decision.
One way that we adapted our strategies to meet tribal communities and tribal health systems where they were at during the pandemic was to shift the way that we thought about providing funding. So usually we have funding and we have a set amount. We knew that wasn't going to work based on the candid conversations through the trusted relationships that we had with Michigan tribes.
As the funder, the person standing between the CBOs, the community-based partners, and the CDC, to be able to translate that into reporting, into data that I know is going to be meaningful for what they're looking for, and then also to have that dialogue.
So just asking them, well, what do you need? And we were able to take funding that was flexible and shift the way that we provided it to the tribe. So instead of giving a set amount, we asked, what do you need and how much do you need and what are you going to do with it, rather than saying, this is what you're going to do with it.
The other thing that we did at the beginning was we really spent a lot of time with the community organizations trying to learn about what are the, I was going to use the word measures, and I'm going to use that word very broadly. What are the measures, the metrics that are important to them in their communities? Not just the things that I had to report to the federal funder, but also the things that were meaningful to the community that really were important to them about the work that we were doing, so that we could make sure that we could combine those things into a really meaningful evaluation that was more than just counting things, but really brought in the stories, the narratives of the communities that we worked with.
One of the tools we developed is called Cultural Integration Framework, which we are really see that cross-cultural communication is the key for all the success for the coalition. The model itself are fairly straightforward. We are using an iceberg as our centerpiece. The iceberg, 1/10 of the iceberg, you can see it very clearly through the cultural stance, language, history. But underneath it, 9/10 of the iceberg is really hidden. Our partners have been able to learn as well. They learn that cultural integration model is really looking into that 9/10 of iceberg, which is really hidden. But if you don't communicate, we'll never know. In our culture, we believe the time is circular. It will always come back. And it's a very different kind of concept compared with the Western style. Time is money. And time passed, then it passed, it will never be back. So when we're starting to do vaccination clinic, everyone asking us schedule members every 15 minutes. Of course, our members will miss those time and they come, they late, they didn't get the shots and they got turned away. So we step in to take the initiative to really utilizing that cultural integration model and let people know, look, our community interpret time differently. Let's open up, not as a 15 minutes time clock type of scheduling, but really invite them to come between noon to 5. And we have that, we welcome walk-ins. We are not afraid to wait.
It's important to recognize the differences between tribal communities because that's going to change how you approach and work with them. That's going to change the materials that you implement and create to get the health messages that are needed to the tribal communities, whether that's symbolism, whether that's colors. Having a feedback loop and getting that information from tribal communities to incorporate into the strategies that you use to adapt the way that you work with them is one of the most important aspects.
So when we change to that different concept and utilizing that cultural integration models, that our partners to know we have the ability and skills to design a deliverables which our community like, which walk in between noon to 5, whenever you come, will serve you. So by doing that, we really increase a lot of vaccination.
So I think a lot of what we were working on this time is figuring out how do we navigate that? How do we make sure the right people are in the right places to be able to get good information to people, counter the misinformation, but mostly building that capacity within your communities to be able to empower the communities themselves to be flexible, to be able to pivot when they needed to and navigate now and in the future.
So creating health education materials for tribal communities is very difficult because each tribal community in the United States has their own nation, their own sovereign nation, and they have their own beliefs, cultures, and values. So representing that on one single document to go to, over 450 tribal communities, it really can't be done. There's no one language that's going to work in tribal communities, but there are symbols that are representative across the board, and a lot of that have to do with protection or respect or the color wheel, for say, the medicine wheel. So if we can incorporate symbols that are across the board recognizable to tribal communities, that helps tailored health education materials become relevant and responsive to tribes across the country. So there's not going to be a one-size-fits-all.
For cultural integration model, we really highlight is that differences of the concept of health. How Asian American define health is very different than mainstream member define health. So we take that opportunity to really communicate with some of the healthcare workers. How do we be able to support the community when you have this very different ideas of vaccination? Vaccinations versus natural immunity. It takes a long time for us to really communicate that into our members and really help them to see both sides. So both sides define health. One is away from pain, one is endurance of pain. So that's what our communities see, that natural immunity is better because it doesn't matter you suffer, but you build it in a natural way versus with the vaccination, you have some of those things stimulate your bodies and create that immunity you need. But down the road, that type of a natural immunity may not be the best solution from our community's perspective.
I think the greatest advantage of what we were able to do with the Vaccine Equity Project is that this was about so much more than just vaccines. This was really about public health. And we had this opportunity to meet communities where they're at, to engage with different people all across the United States, and build trust, build relationships, build partnerships and collaborations.
It takes us time to really communicate how we do this and utilizing that cultural integration model to talk about it's not because of the immunity, it's because of the urgency. So if we coming from a different expectation, explain to our Asian American community, it's not because we want you to give up that natural immunity idea, but because of the urgency and because this is such a massive and really destructive virus moving into the community. So we wanted to have immunity right away. So everyone get vaccinated, have that mass protection.
You can provide tools that can be adaptable. That's one method that we've used, and that's something that we did through the Tribal Vaccine Equity Project, and making sure that logos can be incorporated, tribal health center logos in materials. So there's different strategies that you can do to tailor materials to meet the communities that you're serving.
Maybe we should be talking about how do we measure relationships. Maybe the important metric in this entire project isn't number of shots in arms. Maybe it's number of partnerships and relationships built, because that's what we need next time.